Hi, good evening everyone. I'm Dr. Bhanu Prakash, consultant medical and hemato-oncologist from Yashoda Hospital, Secunderabad. I thank Hetero Group for giving me this opportunity to give awareness about the colorectal cancer on the eve of this March month is notified as a colorectal cancer awareness month. So before going into the presentation, whatever it might be, and the main point at this time point is to give the awareness why we have to know about colorectal cancer, how we can prevent colorectal cancers, and if colorectal cancer is there, how effectively we can treat the colorectal cancer. So before going into the presentation, what exactly is colorectal cancer? So colon and rectal cancers are cancers that develop within the large intestine and rectum. So what exactly is the large intestine? The food what we eat goes into the stomach. From stomach, it enters into the small intestine. So the small intestine connects with the large intestine from right side of the abdomen towards the right side of the abdomen, and it goes up and turns towards left side, and finally it enters into the rectum and finally comes out as feces. So this is the large intestine and rectum where the colorectal cancers develop. So why exactly it is so important? So we should know it is the third most common cancer within the country, and it is the second most common cause of death due to cancer every year. So after lung cancer. So it is very important to know about colorectal cancer, and we should know how should we prevent this colorectal cancer. So incidence of these colorectal cancers mainly starts from the age group of 40 and increases. As age increases, the incidence of colorectal cancer also increases, and it is slightly more in male population when compared to the female population. 90% of the survival, if we detect it very early, we can clearly cure 90% of the colon cancers. So what are the symptoms of colon cancers? The most important symptom is change in bowel habits. Change in bowel habits is like, so whenever any normally if they pass stools every day daily once, suddenly the habit changes, like every day thrice, four times, having diarrhea in between, or suddenly develops the constipation and unable to pass the stools every third day or fourth day. This is a change in bowel habits. The other one is blood in the stools. Blood in the stools, whenever they go to the pass the stools, there might be blood along with the feces, or sometimes there is a black colored stools which is due to the digestion of blood above in the intestine. The other symptom is abdominal pain, loss of weight, and loss of appetite, suddenly losing weight up to 5 to 6 kgs within last 2 to 3 months. Because of loss of blood, they might be anemic and weak, unexplained weight loss. These are all symptoms of the colon cancer. These should alert us for evaluating for the colon cancer. So what are the risk factors for colon cancer? As I told, as age increases, the chance of developing the colon cancer is on the higher side. The other one is tobacco and alcohol. High consumption of tobacco and alcohol leads to the colon cancer. The other one, inflammatory bowel diseases. Persons who are suffering from Crohn's disease or ulcerative colitis has high chance of developing the colon cancer. So this should be screened on regular intervals to identify the colon cancer at an early stage. Consumption of red meat in high quantities also leads to colon cancer. Lack of physical exercise, obesity are one of the causes for colon cancer. And family history is one of the strong cause for colon cancer. So family history, I told, as some of these cancers are genetically related, colon rectal cancers has certain genetic syndromes like Lynch syndrome, hereditary polyposis coli, such sort of cancers which occur due to genetic reasons. So when we look into the colon cancer, we should know why we should identify these colon cancers at an earlier stage and try to prevent and treat them early. So that is the main way how we can reduce the morbidity or mortality due to colon cancer within the society. So if you look at this small figure, you can see a small tumor on the left side is very small, and it is a stage 1 tumor, whereas towards the right side a stage 4 tumor which is very big, which has spread to the lymph nodes and which has metastasized, spread to the liver. These will be labeled as stage 4. Stage 4 cancers are very difficult to treat and very difficult to cure, whereas stage 1 and stage 2 tumors can be cured to an extent of 90 to 95%. So how do we prevent the colon cancers, colorectal cancers? The first most important thing, stop smoking or don't smoke at all. It has to be inculcated in this generation of children properly, especially from the age of school, from the schooling age itself. They should be educated about the risks of smoking and it should be stopped completely. The other one, exercise daily. Daily exercises reduce the risk of colon cancer. Maintaining the weight with proper diet is utmost important. Limit red meat and processed meat. Get enough amount of calcium and vitamin D either in the form of supplementations or from the sun bath. That way we can get the enough calcium and vitamin D. Alcohol consumption has to be limited and it has to be stopped. Properly know about the history of the family history. If any family members are affected with colon cancer, a possibility of genetic reason has to be evaluated and screening has to be done in a proper way. And screening, as per the international guidelines, we have to get screened. Every average normal risk person should be screened from the age of 45 years. So how will we screen? Why screening is required? Screening is a procedure where we do evaluation even before symptoms or any of the complaints are present from the person. They are not patients. They are routine normal persons who are living in the society without any symptoms. For them, we do screening to identify the tumor or cancer at an earlier stage. So what are the options of screening we have? One is stool blood examination, stool based test, that is stool examination. The other one is scopies. Scopies in the form of sigmoidoscopy and colonoscopy. Colonoscopy is the best modality that is available and it has to be done from the age of 45 years for a normal risk person. But if any person who is having a family history, the screening has to be started a little bit early as per their age of incidence within the family. And scans might be required. A virtual colonoscopy can be used for screening, which is not routinely used in India. And if it is a cancer has been identified, we might have to scan with CT scans or a PET scan. So why the screening is required? As I told, it is the second leading cause of death and third most common cancer. 9% of all cancer related deaths are related to the colon cancer. So people over the age of 75 who were screened for colorectal cancer had a 40% lower risk of dying from the colon cancer. So when we should start the screening from? We should start the screening at the age of 45 and has to continue until the age of 75. This will reduce the chance, help in identifying the cancer at an earlier stages and can be treated and can be completely cured. So from the age of 76, it is a shared decision between the patient and the doctor. For testing options, as I told, it is a stool-based examination or a colonoscopy, scopies. So treatment options of colorectal cancer. The treatment options of colorectal cancer include surgery. Surgery is the main modality of treatment. In stage 1 and stage 2 tumors, surgery alone is sufficient. The cure rates in stage 1 and stage 2 might reach even more than 90%. And for rectal cancers, we might have to give radiation upfront to reduce the tumor size and to effectively cure with surgery. So after the radiation, they might require surgery. So chemotherapy is a standard part of treatment of colon and rectal cancers, routinely used either in the form of injection form or in the form of tablets. Apart from the chemotherapy, we use targeted therapies, especially in colon cancers which are in stage 4, based on whether the targets are present on the cancerous cells. We can treat them without any side effects like hair loss, vomiting sensation. These targeted treatments are antibody based treatments which will be given in the form of injections which will attack specifically the cancer cells. The other form of treatment recently came into existence. It is immunotherapy. Immunotherapy is a treatment which increases the body's immunity and makes body immunity to work or to destroy the cancer within the body. That is the standard treatment at this time point for MSI high tumors of colon cancer which are stage 4. So multiple modalities of treatment are available, and the cure rates in colon and rectal cancers are quite high when compared to 20 years before. So thank you.